Really good.
I'm glad.
All right, man. Is it Karan?
Yeah, it's
All right,
probably
beautiful. Is that how you pronounce it?
said it perfectly.
All right,
Yeah,
beautiful.
usually people say Karen, so you're right on point.
Yeah, I grew up with a guy named Karan, so uh,
Oh wow,
not
good to hear.
unfamiliar.
All right.
Anyways, how's it going, man? How can I help you?
Yeah. So I'm guessing my brother contacted you, but it's more just First of all, I think Plum Health is a cool initiative. Not an initiative. I just think it's a great movement. I had a couple of questions about that, and I just wanted your advice because as someone who's planning on going into medicine, I'm a senior at Michigan State right now,
Sure.
and I just wanted your advice. I wanted to just see if I could seek your help and mentorship in a way as well. Just because I like your view on medicine, I've looked at your TED Talks, I've looked at some of your podcasts, and I just like the way you look at the world of medicine. I've heard a lot of doctors talk about burnout and how they've lost passion for their craft in a way.
Yeah,
And I
totally.
wanted your opinion and just your thoughts on it too.
Yeah, definitely, man. Let's start. Where do you want to
Okay.
start?
I mean, first of all, I if we start off with just Plum Health, I wanted to ask you just. I was reading up about it, and basically, you can correct me if I'm wrong, but with the idea of you have like a certain amount of patients, and that you give them your time of day instead of just like a quick 8 minute, like just meeting as you've said. Now, as you scale, do you see that time going down? Because if it's usually like an hour a day, would that possibly conflict with your mission to give every individual
Yeah, so I guess we grow as a business by employing more doctors and helping to free them from those short exchanges with patients and giving them the time and space to develop, unique, close relationships with their patients. So scaling in my biz looks like, I'm going to stay with 470 patients, which is where I'm at, 450 to 500. I think I have like 475, 480 right now.
uh-huh.
And that allows me to have, a good 5 hours each day of patient care because I
Right.
typically see about 5 patients a day, sometimes less, sometimes more. And then it allows me like 3 hours a day to work on the business,
Mhm.
just
Okay.
branding, marketing, communications, strategy,
Right.
hiring other doctors, working
Okay.
with our medical assistant, things that help our business run smoothly. I can do in my free time when I'm not seeing patients. And then, scaling looks like bringing on another doctor and allowing them
Okay.
to build up a panel of their own, 450 to 550 patients or
Gotcha.
so that they can maintain those close relationships, not feel burned out, and practice medicine more or less on their own terms.
Gotcha. So rather than like you taking on more and more and your time going down, you're taking on more doctors and then it's just expanding the care.
Exactly. And, I'm trying
Okay.
to bring on more and more diverse physicians. So,
Right.
I started this, I'm an allopathic doctor, which means I'm an MD. Um, and
Mm-hmm.
then the doctor I hired next was a DO, doctor
Mm-hmm.
of osteopathic medicine, and she's also a woman. So she
Right.
found that her practice grew quickly when she started with us because I was taking care of a lot of men who preferred a male physician, and those men had, wives, girlfriends,
Sure.
mothers, daughters who also needed excellent primary care. And so once Dr. Raquel joined, Dr. Raquel Orlick, her
Uh-huh.
practice grew pretty quickly that way. So it'd be cool to bring on other people with other interests like functional medicine or nutrition or
Right.
sports medicine so that we can have a balanced approach. Some patients are going to need different sorts of primary care or more
Awesome.
nuanced care in certain areas. So it's kind of
Yeah.
exciting to build a team that, reflects the needs of the population that we serve.
I love that. And so since we talked about burnout for physicians, so for someone going into medicine, is the burnout necessarily just from the fact that you kind of lose sight of what you went into medicine for, or is it more just overworking, or is it a combination of those things, or is there more to it?
Yeah, I think so. I think if you look back at the patient panels of doctors before us, they're much smaller than what we currently have now. Currently, doctors have 2,400 patients per panel. So that's,
Yeah.
that's, you're seeing 24 visits a day or having about 20 minutes in total per patient. And that includes documentation time. So you really get that, like I say, that 8 to 12 minutes of face time with your patient. And then you have 8 to 12 minutes of documentation to do for each patient, and then you move on to the next one. And it's really hard to, just communicate on a human level that you care about someone when you only
Mhm.
spend 8 minutes with them.
Yeah.
So, I argue that doctors are feeling burned out because there's a systemic problem with the way we
Mhm.
practice medicine, especially primary care medicine. And that's why you see older doctors leaving the field,
Mhm.
and younger doctors just more and more unhappy with the current state of medical practice.
Okay. That's cool. So with practicing in Detroit, I was looking at your prices too, which first of all, they seem extremely reasonable enough. When I'm in, I definitely want to, because they're so reasonable that it's just like, why wouldn't you, right? And so I was wondering in Detroit, especially with the community that's there, where some people might not be able to afford it, especially individuals that are more in the poor conditions, how do you plan on reaching out to them? Like, do you see like, changes in prices, or is it more just, yeah,
Sure. I mean, we take care of people across all income spectrums. I say, like, if you have an income of some kind, you can afford our services at Plum Health. Um, if you can afford a cell phone,
right.
you can afford a membership with Plum Health. Or if you're a family of four and you
Mhm.
can afford a cable bill for your family, then you can afford a membership at Plum Health. And so, I think we're extremely affordable. And, there are people in this community who can't afford it, but they qualify for Medicaid. So,
Okay.
I can't serve everybody, but I
Right.
can serve most people. And we do bridge a really important gap, especially for people who make too much to qualify for Medicaid. So, as an individual, if you make less than $17,000 a year,
Mhm.
you qualify for Medicaid. If you make over $17,000 a year, you're disqualified from Medicaid. So a
Yeah.
lot of people in our community are truck drivers, bartenders,
Mhm.
waitresses, hairdressers, etc. And they make too much to qualify for Medicaid, but they don't make enough to buy private insurance. So they fall in
Gotcha.
this gap of care where they're working poor, and like any little emergency or urgent care thing could bankrupt them because, let's say they go to the
Right.
emergency department, they're uninsured because they cut their finger at work, and their work doesn't
Right.
offer health insurance. So then
Mhm.
it's like, that's a $2,000 bill that potentially
Mhm.
they may be on the hook for. And their total income per month is $2,000. So it's like you wipe out your
Yeah.
entire monthly income, you're behind on rent, you're behind on your car payment, you can't buy groceries. And so if one of those people is a member of our office and they pay $49 a month to be a part of our service, we can sew up that laceration in our office at no charge. And
Right.
that's could potentially be a, you know, prevent an economic disaster for a household.
Right.
And that's why I'm so passionate about this, is because we really
Yeah.
do serve a lot of people in that demographic and help them
Mhm.
through tough times, and that's
I love
important to
that.
me.
I love that. Honestly, that is one of the reasons why I went into medicine, because growing up in India, I saw poverty everywhere. You see these individuals who can't afford it, and when they do get sick, they just keep it to themselves and they live with it. Unfortunately, pass away sooner than they should have if they had access to care. Something that's a big issue in India. And I didn't really realize it when I moved to America. I was like, oh, America, it's this beautiful place, everything's fixed. And now going into medicine, it's interesting to see these like holes and poking holes, and like now seeing these new ideas that are coming in that really do kind of connect with me and my passion for why I want to go into medicine. So I do think it's awesome what you're doing. That's why I was like, I do want to talk to you and just see your side of things and what you think. And now, I'm sorry, go ahead. I thought you were
No, that's a great perspective, man. I really appreciate that. That's a nice way of phrasing it. You would think that a wealthy industrialized nation like the United States would be able to provide adequate healthcare for people.
yeah.
But, I think I think the Affordable Care Act codified some really perverse incentives in our system. And that
Mm-hmm.
is, it enshrined health insurance as a mechanism to get health care. And the
Right.
unfortunate part is that insurance companies don't provide health care. They
Right.
provide a financial tool to prevent you from going into bankruptcy. But now they're trying to provide all everything, from
Yeah.
flu shots to ICU care, and it inflates the cost of everything.
Right.
And if you can't afford insurance or you don't have insurance, that's where you really get screwed over by the
Hmm.
health insurance industrial complex, where you can't buy things on the free market. And then in healthcare, typically, unless you come see us at Plum Health or find
Right.
another direct primary care physician, and if you try to buy things through the hospital systems, they have this
Hmm.
giant insurance-based markup where an MRI that should cost $300 now costs $3,000 at the hospital, and then they give their insurance members a discount, so now it's only $1,000.
Right.
So they pay maybe their insurance covers two-thirds of the cost, and then they're left with one-third of the cost. So you pay $1,000 for a $3,000 scan, and the scan is actually $300. And this is, these are the
Right.
kind of the perverse incentives in the system that we need to shine a light on and make
Right.
people aware of these discrepancies.
Right. And that's really cool that you pointed that out. And also, I feel like this year in general just has pointed out all the things that are not just wrong, but just going just in the wrong direction with medicine and the way doctors are treated and all those things. So
Sure.
I
Yeah,
think,
it's like you have a good job with a company for 10 years, and then you have
right.
health insurance through that company. Therefore, you can see doctors X, Y, and Z. So you pick Dr. X, and then you get
Right.
fired or laid off, or the company downsizes,
It's gone.
and you no longer have that health insurance, and therefore you no longer have that doctor. And it
Right.
makes zero sense. And I think more and more people are experiencing that with the pandemic and the changing employment landscape that we're looking at in this country. So one would hope that this would be enough to make some significant changes, but I think that there's too many vested interests in the status quo to make radical changes, that we would need to truly overhaul our system and make changes. But that being said, I feel like as individual physicians and community members, we can kind of push this on a grassroots level to
Right.
build momentum for independent practices and transparent pricing,
Of
and
course.
giving people value for their healthcare dollar.
Yeah. Again, that's a great point. And now, since we were talking about 2020, and obviously the biggest thing about 2020 is COVID, how has Plum Health been doing through COVID? And I wanted to see how, as a direct primary care place, how's that changed you, moved you guys forward, etc.
Sure. I mean, it's been good overall. More people have needed healthcare services. So we've had a lot more people sign up throughout the pandemic. So our
That's
practice
wonderful.
has grown, but then it's also been stressful in that, it's a somewhat dangerous situation for ourselves and our staff. Like
Hmm.
my biggest thing is protecting our community, protecting our staff, making sure everybody's safe and healthy. So I've been doing a
Yeah.
lot of engagement like this, speaking with people, doing some interviews on radio and podcasts
Hmm.
to really get the word out about mask wearing, hand hygiene, and things
Of
that
course.
can slow down the progress of the pandemic. So
Right.
I would be lying if I said it didn't take a toll on me, like
Yeah.
emotionally. It's definitely been hard, but I'm still enjoying the practice. And so one of the things I say is I take my worst day in direct primary care over my
Hmm.
best day in fee-for-service medicine any day, because I feel like there's
Okay.
a lot more purpose that I have here, and I can
Yeah.
be a lot more effective and nimble in the kind of services that I offer and the way I use my time for the benefit of our patients, our community, our employees, et cetera.
Right. That's a great answer. So now shifting it over to so right now with all the things going on, pre-medicine students like myself that are interested in going to medicine, obviously shadowing opportunities and things like that are just scarce. Can't really find anything like that. What would you recommend for people that are looking to get into med school? How could they, get more experience, especially now from your perspective as a doctor? What would be something that would enrich, our viewpoint to,
Sure.
make better
Yeah.
physicians in the future?
Yeah. I think, there's a couple things you can do. Having a consistent place where you volunteer is always helpful. It doesn't necessarily have to be shadowing a doctor. It could be working at a free clinic, or working in a soup kitchen, or otherwise making the impact can you develop a project or an initiative on your own that, gets socks for people or jackets, winter jackets or shoes or something, some tangible way you're making an impact on the community. I think that's more, as I've interviewed medical students and medical residents in the past, something like that speaks more volumes than shadowing. And I think
Right.
medical schools should recognize that as well. And I think medical schools ought to recognize that this pandemic has inhibited a lot of
Mm-hmm.
medical, pre-medical students from volunteering. I think the question should be, what did you do during the pandemic to help other people?
Right.
Would be the best possible question coming from a medical school interviewer, in my opinion. And then you just leave it open, and maybe you've done nothing. And so it's like, okay, why is that? Do you not really care about the community, or, what
Right.
are you in this for? And I think that's kind of a more poignant way of looking at it. But, more tangibly, I know that some pre-medical students who've graduated from undergrad who haven't been able to get in on the first go around, they become a phlebotomist or,
Mm-hmm.
like a hospital technician, where they're wheeling patients to and from MRIs or CT scans, or from one ward to the next, or,
Right.
doing some other work like that in the hospital system, gaining firsthand experience. And that speaks volumes about a candidate as well, where it's like, if you're able to go into these hard places and you still want to go into medicine, that
Mm-hmm.
speaks volumes about your character as an individual.
Okay. I like that. Now, a more personal question. Like, I wanted to see, why did you go into medicine? What was like your path into medicine, that, like, from high school to college, where it was like the steps that confirmed, like, all right, this is what I want to do?
Sure. I started volunteering at a free clinic in Detroit called Cass Clinic
Mm-hmm.
on Cass Avenue. Uh, this is like pre new Detroit, this is
Yeah.
2004, and things were quite a bit different. And we had a line of people from halfway houses, nursing home across the street, like old folks home across the street, and just homeless and uninsured folks who needed really good medical care but couldn't afford it. And so, we'd see about
Right.
40-ish patients a day in like a 3 to 4 hour morning. And I worked shoulder to shoulder with medical students at Wayne State. And there was a family physician there who seemingly could handle anything that walked in the door. And so, I wanted to have that kind of skill as I
Right.
progressed through my training. And so I set my sights as a
Mm-hmm.
17-year-old, like, I want to go to Wayne State University School of Medicine, because what these students do is amazing. Like,
Yeah.
and then beyond that, being a doctor would be cool too, I guess. But I'd like
Right.
to be where these medical students are. And
Yeah.
so I did that. I became, went to Michigan State for undergrad. I volunteered
Cool.
at Sparrow, and I also
Nice.
worked at Olin Health Center in their like health
Yeah.
education department, which is
Yeah.
really a cool experience, because I helped to, they did this like social norms campaign that they may still
Uh-huh.
do, but it's kind of like explaining to students that, okay, not everyone drinks 5 beers on the weekend. Most people
Yeah.
have, like 40% of students have 1 or 2 drinks per
Right.
week. And it's only like, 20% of students that are binge drinking every Friday and
Yeah.
Saturday, right? So then
Exactly.
you kind of help to enforce normative behaviors around healthy
Mm-hmm.
activities. And so we did that. We went out to different bars and restaurants, like on
Mm-hmm.
foot, and delivered these posters that kind of explained some social normative behaviors. And they would hang them up on their bulletin boards or on their windows to try to reinforce that on campus and in the community. So it's kind of a
Right.
cool experience that taught me a bit about like marketing and shaping people's perceptions. And I've used some
Right.
of those skills out of that experience to, grow my practice.
Imagine.
Yeah.
I can imagine. That's wonderful. I actually didn't know you went to Michigan State, so that's
Yeah.
good to hear. You're one of my people.
Yeah. Go green, right?
Exactly. Go white. So, um, I mean, those are really kind of the questions I had for you. I wanted to just see your journey, and I think it's a very rich one as well. Now, with this is just a very broad question. With medicine, I feel like you've covered it, but I want to ask it again. How do you see it move with telehealth services and all those things that have happened this year? We've seen what needs to be changed. How do you see the medical system as a whole moving forward in this country?
Sure. I think people are always going to need well-trained, well-educated physicians who can develop, respectful, sincere, and trusting relationships with their patients. And
Yeah.
that's what I'm here to do. And I've proven that this kind of model has value. I have fewer patients, but I have better relationships with my patients.
Right.
And I think there are millions, there's 380 million Americans, right? And
Hmm.
I only need 500 patients to be successful in doing what I'm doing. And I
Hmm.
think our country is big enough, broad enough, diverse enough where you can do something similar anywhere in America basically and be successful. So that being said, I think that there's probably going to be an 80-20 rule in place where 80% of people are really happy, or maybe not happy, but
Yeah.
content perhaps
Right.
with their health insurance coverage. And I think 20% of Americans are going to be looking for something different,
Right.
where they want price transparency or a better relationship with their doctor or more on-demand services. And I think telehealth is kind of going to scratch an itch for some people, but
Hmm.
it's not like the individual person-to-person relationship
Right.
that I have with my patients. Um, and then in context, 1.3% of family physicians are doing direct primary care. So I think there's a
Hmm.
huge upside on this movement where, potentially you could see up to 20% of family physicians going into the direct primary care model. And I think
Right.
there's something like 130,000 family physicians across the country. So that's,
Right.
tens of thousands of doctors making the transition from fee for service to direct primary care.
Yeah.
Um, I think these health insurance structures are going to stay in place, even though
Hmm.
there's very little competition and very obvious perverse incentives,
Right.
where the only way health insurance companies can make more money is to
Hmm.
grow the size of the coverage. Uh,
Yeah.
and I talked about that in my most recent TED Talk at TED Talk, TEDx Detroit, where
Yeah.
it's like there's this, I think it's an 80-20 rule where 80% has to go to paying bills for patients
Hmm.
and 20% can go to marketing and compensation, executive compensation and all that kind of stuff.
Right.
So basically, if you want to grow your salary as a healthcare executive, you just spend
Yeah.
more money on healthcare, which means inflate the prices of healthcare, not necessarily cover more people, charge higher
Yeah.
premiums. And there you go. You have a higher
Yeah.
salary for yourself. So I think that's a
Yeah.
really perverse incentive in the healthcare system.
Absolutely.
And I think we're going to see that trend continue unless there's
Hmm. Of
major reform. Unfortunately,
course.
I like some parts of the ACA,
Hmm.
the Affordable Care Act, but it codified a lot of these perverse things in the health insurance ecosystem. Um, the other concerning trend, I guess, is the growth of mid-level providers.
Hmm.
And I think this is on the part of hospital systems and health insurance companies. They're looking to replace doctors with nurse practitioners and physician's assistants who have
Right.
less experience. And we've seen some, disastrous effects in
Right.
individual cases of mid-level providers missing some obvious diagnoses and causing
Right.
real patient harm and even death. There's a recent book that came out about this. Um, and so I think, for doctors, it's going to be more and more
Right.
difficult to be a physician, to be a really good physician, to have enough time for your patients,
Right.
knowing that there's going to be other quote unquote providers who can do it
Yeah.
cheaper. Uh,
Yeah.
may not be as good, but it will be cheaper. And so I don't know if that's the best direction for our country to go. I can
Right.
understand mid-level providers filling in supervised roles, but
Yeah.
I think there's some concerning trends there as well.
Yeah.
Um, but people are always going to need healthcare. People are always
Yeah.
going to be looking for the best physician possible, excellent
Yeah.
doctors who can care for them in a comprehensive way. So I think if you set your sight on being an excellent physician, you're always going to have a good job and a great way to serve people in your community.
Amazing. Yeah, it is unfortunate that, you know, the way the healthcare system is set up, it's really just lining the pockets of the people at the top. And that's unfortunate because that's not what it should be about. And again, that's where, Plum Health and places like direct primary care, they're practicing that come in. And I think it's great. And I mean, those are really the questions I had for you. I mean, do you have any advice for, again, I asked, but like just a quick little thing about people going into medicine, something that, because I'm sure it can get discouraging with how hard it is and with how competitive it is, something that helps you just, keep grinding throughout the process and that you think younger generations would benefit from if they're going through the process.
Yeah, I mean, I've always had a purpose-driven life in that, this is what I've always wanted to do. I didn't really have a name for it when I was
Yeah.
17 or 18 or in college or in medical school, really. I only had a
Yeah.
name for it when I heard about it at the tail end of my medical school training. It's called direct
Mhm.
primary care. And I was like, oh yeah, that makes perfect sense. And intuitively, I could feel that.
Yeah.
So if you have some higher, bigger purpose than yourself, then a lot of doctors go into medicine for a lot of different reasons. I think a great reason to be a doctor is that it offers professional satisfaction in that, there's, it's challenging, it's complex. There's complexity. As a physician, a lot of times you have
Mhm.
autonomy, unless you're employed by a
Right.
restrictive network or restrictive hospital system. And then you have a balance between effort and reward, where the harder you work, the more rewards you have in terms of patient satisfaction, professional satisfaction, and sometimes money, which is important as well. Um,
Yeah.
and then beyond that, doctors choose medicine because there's prestige there, um,
Yeah. Of course.
and that's undeniable.
Yeah.
And so, I guess if you can set before yourself a purpose beyond
Right.
the like bells and whistles of like prestige or a fancy car or a country club
Right.
membership or anything, if there's a purpose there that drives you and you're able to execute on that purpose, I
Yeah.
think that's why you should go into it. And if you
Right.
don't, maybe pick something else, because
Right.
medical school is a grind. It's arduous. You're studying easily 60 to 80 hours a week. Um, and then in residency, you're easily putting in 60 to 80 hours a week. So that's
Right.
like 7 to 8 to sometimes 12 years of your life, depending on how
Yeah.
long your residency training is.
Right.
It's a long time if you
Yeah.
don't really have like a bigger purpose that you're trying to pursue.
Yeah. It's
Because
the idea.
you can feel empty if you're just doing it to enrich yourself or because it makes you look good or prestigious.
Right. It's the idea. Just I've heard it before. I think they call it like know your why. That's the where you're going.
Yeah, exactly.
Exact.
Start
Right. I
with
mean,
why.
start with why.
Yeah,
That's a
that's
good
the
place
old
to end
Simon
it.
Sinek book.
Exactly. I love Simon Sinek. But yeah, I mean, that's all the questions I really had for you. I really do appreciate what you're doing with Plum Health. And yeah, I hope we get to meet in person, obviously, but it was really
Yeah.
nice talking to you. And
Likewise, Karan.
yeah, thank you very much. And you have a nice rest of your day.
You too, man. Take care and good luck with the rest of your training here.
All right. Bye.
All right. See ya.